education has always been at or near the top as an issue for people. They also talk about healthcare as an important issue. People worry.
The first important announcement that Laurie Pryor received when she decided to run for the Minnesota legislature was from Democratic incumbent Yvonne Seltzer. Earlier this year, Yvonne told her Northern Eden Prairie and Southern Minnetonka constituents, that's House District 48A, that she would not seek a third term. Laurie Pryor, longtime Minnetonka resident, told herself now is the time. As a mom and volunteer, Laurie's advocated for better and more affordable health care and schools and multimodal transportation systems. As a past campaigner for Representative Yvonne Seltzer and Maria Rude, Laurie Pryor has visited with thousands of Minnetonka and Eden Prairie residents, and that's what she's going to be doing between now and November. She'll face challenger Mary Shapiro, who won the Republican primary held on August 9, 2016. Laurie, welcome to Democratic Visions.
Thanks for having me here today.
I know you're a first-time candidate, but I also know you've worked exceedingly hard for Yvonne in prior elections that were extremely close. Mm-hmm. What's your takeaway from those close elections that Yvonne went through?
There's a couple things that I've learned from those elections. One is what really matters is talking to people. I mean, we saw all of this money.
Door to door?
Door to door. Door to door and on the phone. Okay. We saw all of this money being spent from the outside. And one of the things that does happen is all of the negative campaigning, it does suppress the vote. People get discouraged, maybe they're not going to vote. So what we did in those previous campaigns and what I will do in this campaign is just keep talking to people, because when you make that face-to-face connection with somebody, mm-hmm. when you listen to them about what's important in their lives, what they think is important in government, what they're hoping for, what they're afraid of, then you know how to be a representative, and they feel encouraged about the process. They feel like they have a voice in the process. They vote, and you're also the one that gets that vote because you're the candidate that was at the door and that showed that you understand them. In our district, when you're at the door and you're talking to somebody, they don't feel like a stranger. I think that's just, our neighborhoods, they're friendly neighborhoods, and the dogs at the door, the cats running out. It's part of the fun part of campaigning.
What do they want to talk about? Is education close to the top?
Yeah, education is close to the top. And ever since I started going door to door as a volunteer with the other candidates, education has always been at or near the top as an issue for people. They also talk about healthcare as an important issue. People worry about the cost of insurance and healthcare, why the cost keeps going up, but it doesn't seem that we're getting always better care. This isn't a partisan issue. This is a problem-solving issue.
As you talk to people, I'd like to drop back again to
Yep.
education.
Yep.
What ideas are they most concerned about, or are they what's on their mind relative to education?
Well, of course, it's the whole spectrum of education. Mm-hmm. You start with pre-K, mm-hmm. early childhood, making sure that every child has an opportunity at pre-K learning. You're talking about the K through 12 system and making sure there's a stable funding base for K-12 education and public schools. And then also we're talking about post-secondary, when kids have left high school and maybe they're on a 4-year college track, or maybe they're at Normandale or other kinds of education to follow up past high school. Many of them are struggling right now because of the debt. They've got so much debt that they feel like they don't have choices. And that's what people want. They want a choice of a job, and they don't want to have to feel like they're going to be in debt for the next 20 years or until it's time to heading into retirement and they just finished off their student loans.
It's a major problem, no doubt about it. Mm-hmm. But tell me, what realistically can be done at the state level mm-hmm. relative to either putting a check on the higher cost of post K-12 education, or perhaps dealing in some fashion with the significant debt? Is there something that the state can do relative, for example, to refinancing?
Right. So, I think those are the 2 points that the state can help out on. First of all, in the past, there was a tuition freeze. And what it meant was that the state was providing more funding for the post-secondary system. And that helped when we had a freeze on tuition. In the last session, that's not something they could get passed. I think in the next session, it's something that we should pursue again, is that freeze on tuition. Then there's also been programs to help students refinance their loans and get better interest rates. We're seeing lowest rates in history on mortgages.
Yeah, it's almost incredible that there's some obstacle to being able to restructure a student loan.
Right, and to get those historic low interest rates.
What aspects of healthcare do you feel have to be addressed by the Minnesota State Legislature in the upcoming session?
There is a model right now in healthcare where instead of being fee for service, like doing procedures and running tests, it's fee for
You mean the
outcomes.
bill that runs about 2 or 3 pages
Right,
for every little
right,
thing
right.
that was done?
All the aspirin and Tylenol and everything they can charge you for.
Right.
And that's how providers are getting paid. Hospitals are getting paid.
Right.
But we can move to a system where hospitals and healthcare systems are getting paid also for keeping people healthy, for keeping people out of the hospital. So it's right now they're looking at things like readmission after hospital stays. A hospital they should be rewarded for not having readmissions, that people leave the hospital ready to heal and ready to be better and not be in that revolving door where you send them home, they get sick, they're back in again. And those are high costs. So if we can reduce readmissions and do other issues like that where we're keeping people healthy, bringing them back to health, then we're going to lower the cost of healthcare, and we all win because we have a healthier population.
So let's talk briefly about transportation. Southwest
Yes.
Light Rail to run from Eden Prairie downtown to downtown Minneapolis.
Yes.
Are you a proponent of that system?
I am a proponent of that system. Here I will be following Yvonne's lead, and what she's done is she's been the nag. She's taken the lead on this issue where she is talking to the governor's office. She's talking to her leadership. She's talking to everybody that she can talk to make sure that stays on the radar, that we don't let this slip away. I will take up that issue and I will make sure that it's front and center and that nobody forgets about this. And we're seeing, some of the other Republicans that are in districts that would benefit from the light rail are not taking that leadership role. So it's going to be up to who's ever in my seat, and it needs to be me so that I can follow Yvonne's lead and make sure that we're taking leadership on it.
So I'd like you to step back, if you would, Laurie, and just tell me, what's your vision of House District 49A? What attracts you? Why are you living in this area?
I was out last night door knocking, and I keep going to these neighborhoods, and they're beautiful neighborhoods. Nice, quiet streets, but easy access, parks and schools and mature trees and water features and all of these things that people really value. And you talk to people and you say, I'll ask them, well, how long have you been in your house? And it's like, 53 years, 16 years. Really? Yeah, we've been here for 10 years. Wow. And it's like, I talked to a young man, 34 years old, that grew up in the house and bought it from his father. People move into this area and they want to stay. For us, my husband and I, it was a great place for us to bring up our 3 kids. They went to the Hopkins Public Schools, they graduated, they got married, they came back to Minnesota, they live in Minneapolis. And I think that's one of the strongest feature of the district that I'm from and why I would be so proud to represent 48A.
One of the most daunting things about serving in the legislature is when you're elected, you'll be representing 39 to 40,000 people. I mean, that is remarkable.
And I'm going to try to meet all of them, but I don't know.
Well, but my point is, you're not going to be representing 39,000 or 40,000 Democrats.
No.
You're going to be representing Democrats, Republicans, and Independents.
Right.
Do you see any difference between those individuals as you go forward in your quest for this office?
Well, certainly you could call out an issue and you would find differences between them. Door after door, person after person, Republican, Democrat, Independent. People don't like to see waste, and one waste that we see in the legislature is a waste of time, where they keep working on an issue and then save it till the last minute of the legislature, and then it shuts down without getting passed. Part of that too is the gridlock and the partisanship. They don't want to see that in their representatives, and so I know that my job will to be work across that divide. Reach out across the aisle and talk with people. Talk with people that might have slightly different ideas about what's the best outcome, but there'll be things that we agree about, and that's what we focus on.
But I've been watching, I watched the Republican National Convention, and it's like Armageddon. I mean, the world is falling apart.
Right.
Do you sense that when you're out talking to people, that's the prevailing attitude in your area?
It's not the prevailing attitude. Mostly people feel really good about where they are right now, but they have concerns about others. So their lives are safe, they feel happy, they feel secure, but they are concerned about others, and they are concerned about the violence that we see, and they want to see active steps taken. and common sense steps for preventing some of this violence. But even as I say that, there have been a few people that I've talked to where they do feel threatened right now. I feel like, part of my job as a legislator and a candidate for the legislature is when I talk to people, it helps, it does give them that sense of hope and connectedness that when they can talk to someone that's their representative, I think they do feel more secure, and that government isn't just an entity out there doing things to them, but government is part of their lives, and that they have that voice in government.
Well, here's a question that I know you're going to give me the right answer on, but is your campaign comprised of Laurie Pryor type people who are willing to go out there and work as hard for you as you worked for Yvonne?
Right, it is. It is. We have great volunteers that have already been out, and they're amazing. People are coming. They'll
Well, they got to emulate what you've done in the past.
And I think they do me one better. And I'm so honored to have the people involved in my campaign right now.
That's great. Laurie Pryor, thanks for stopping by.
All right.
Best of luck.
Thank you, Tim.
Democratic Visions is handcrafted by volunteers from Eden Prairie, Hopkins, Minnetonka, Edina, and Bloomington. Watch us on select cable systems and on our YouTube channel. This is Carol Sundstrom.